Hi, my name is Dr. Ken Rictor. I've been in practice now for 27 years with Scotland Family Medicine, and we've most recently converted to a direct primary care since 2014. And I'm now a partner with Kygo Health as well. With Kygo Health, what really benefits is for the patient to have that personal care assistant. There's a lot involved for us to be able to take care of patients from multi-levels, from the idea of specialties, from ancillary services, and by Kygo Health partnering with this helps the patient feel engaged in their health care, and also eliminates that amount of time that we would have to do that outside of that direct patient care. So it's a great partnership because together we're just all benefiting that patient's welfare. When I really decided, as you go through medical school and you go through your training, you have to decide what residency to do. And my problem was, and maybe a benefit, is that I enjoyed everything that I did through medical school. So I wanted a specialty that incorporated all of that, and that was family medicine. What I found was the specialty that was able to allow me to practice to maximal benefit and effort. I've been in practice for 27 years, and as times changed, the family practice role became more of an outpatient specialist, much more than combining and doing everything. And although I still love that Norman Rockwell image of being able to go to the hospital and being able to do multiple things for the patients, it really now has become an outpatient specialist. And primary care has now moved into the realm of prevention and to be able to manage the patient from an entire level, to be able to manage them from a level of getting them to the right specialist at different times, or to manage ancillary services. So for the past year and a half, I've been doing direct primary care, again since March 2014. And I've found that with direct primary care, this has really escalated our interaction with patients to a very, very integral level in their entire health care. Well, with family medicine, we really do take care of patients cradle to grave. And there's no specific age group that we would manage. Because of healthcare needs, generally that's an older patient. That older patient, because they're just running into more kind of maintenance type of healthcare. But we find that we serve all age groups. When we're taking care of newborns and we're taking care of kids, it's more of just prevention and immunizations. When you're taking care of young adults, it's more of maintenance of good care and prevention of illnesses that go on. And when you're taking care of those older individuals over the age of 65, again, it's still based off of prevention, but it's also a lot of times as disease management as well. I think that with direct primary care especially, that our services are directed toward the patient. Because I have no formal relationship with insurance companies, we have the relationship built directly with the patient. And so I think it's really critical that the patient realize that this is a true partnership. This isn't me dictating to you what to do. This is me talking to you, plotting out a plan, and working together on what's best for both of us in order to take care of you down the road. And I want a patient that's going to be deeply involved in their health care to realize that it is the most critical thing that you can do, because all else stops when you're not healthy. No matter what you want to do, no matter what you want to achieve, it all stops. And it's the universal constant, no matter where you are, no matter what income you have, no matter where you are in the status of life, it all stops when you're not healthy. So I think that the pivotal role that I want is to be able to partner with you so that you can really have that benefit of maximal quality health care. One patient comes to mind as we had an individual that came to us as a new patient, and in going through their past medical history, it was found that the patient had been diagnosed with an abdominal aortic aneurysm. He was diagnosed with this 3 to 4 years ago through a CAT scan, and it was recommended that at that point that the patient continue to follow up with CAT scans to know the timing of repairing this abdominal aortic aneurysm. I asked the patient, when was your last CAT scan? And he told me that he hadn't had one since the original diagnosis. The reason was that he couldn't afford the CAT scan. The original price that went out to his insurance company was over $2,000. He had a high deductible that he had to meet, and he was not able to afford another $2,000 CAT scan. I told him that through direct primary care we were able to strike up relationships with imaging companies, and that his CT scan would cost no more than $200. Because of that, he went to go get his CAT scan. His CAT scan showed that his aneurysm had approached a level that needed surgery. He got the surgery and is now doing great. Without that CAT scan, he was at such a risk of rupturing that CAT scan, rupturing his abdominal aortic aneurysm, and losing his life. Losing his life over the fact that he could not afford an elevated level of a CAT scan that should have never been that high. So through our efforts at not only managing the patient, but managing those other issues, which in our day and age, healthcare cost is such a huge level of concern that it actually makes healthcare less accessible because of the cost. And physicians before have never approached this. Through direct primary care, we're now able to manage patients' costs to make them reasonable levels. This alone was instrumental in this patient now going to enjoy long-term health, long-term good care without the risk of this ending his life suddenly through a ruptured abdominal aortic aneurysm. When you're looking for advice as to what would be the most important aspect to obtain optimal health, I would say it's more of partnering with your healthcare provider. One of the things we find with Kygo as well as Kygo Health is that partnership is realized by having someone that could be that personal care assistant that looks over you and looks over your healthcare needs and helps to coordinate it with me. Now, what I feel is that for any patient to really partner with that healthcare person that looks at them from the standpoint that we're going to be your physician, we're going to be your caregiver from here on out. Not just when you get sick, not just when you knock on my door, but on other advice deals that when you go through different aspects of your life, there are going to be different things that you need done. And that needs to be coordinated through your family physician. A family physician who is not engaged in this or is more reactionary to you just coming in that door, you're not going to have that quality health care. It's more of an analogy that we would rather be the person that corrects your engine before your engine light goes on. So if you want to be the patient, the engine light goes on, now I need to see somebody. I don't want that. I want it to be your engine light never goes on. And so that's the best tip that I could say. You want someone that's engaged in that. Our day and age of primary care medicine has really turned into how many people can I cram into a day, which limits your access and limits your time to that physician. The reason we've gone through direct primary care is because I don't feel that fee-for-service medicine is the way you should treat patients anymore. It's not enough time and it's not enough commitment to what goes on. Direct primary care allows me that time that I can really look into what goes on with that patient and provide them that optimal care. So as advice, you need someone who's willing to invest their time into you because you're investing your belief and your confidence in them, and it should only be returned in an equal measure. Again, I was born in Baltimore, Maryland, and lived most of my life in Maryland. I grew up as a die-hard football fan, initially with the Baltimore Colts. Might discourage some people from listening to this, but then I did my medical school, University of Maryland, did my training in near Pittsburgh at the Washington Hospital in Washington, Pennsylvania. And then I moved closer to Maryland and established my practice in Scotland, Pennsylvania. I picked up a bunch of hobbies by being in Pennsylvania. One was fly fishing, which I really love. There was a stream right behind my office and I learned how to fly fish and tie my own flies. I did missionary trips to Russia, and there I took a camera and took so many pictures that I actually destroyed the camera by taking so many pictures. But that launched me to get another camera, and I fell in love with photography. So I've really been just an avid photographer here for about the last 4 to 5 years, and have done weddings and portraits and really enjoy that. When Baltimore lost its Colts, I waited, and when they got the Ravens, I now am a season ticket holder for the Ravens and have been to almost every game, so pretty avid football fan as well. So that's about it. That kind of colors me, you know, for you kind of an idea about where my passions lie.